PRP for receding hairline? How many PRP treatments would it take for some visible results on a 40-year-old man's receding hairline, which is mostly on the sides and not in the center? I know that results vary from person to person, but wondering if it is possible to get a general idea. Thanks.
Thank you for your question. You submitted your question with a single photo, and you're asking how many PRP treatments will it take to see results in a situation like yours where you have a receding hairline in the temple area, and you've already wrote in your question that you understand results vary from individual to individual. Well, I can certainly share with you how I discuss our approach to hair loss treatment for a patient like yourself in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed with PRP and a material called extracellular matrix going back now 7 or 8 years, which evolved out of hair loss treatment for using hair transplant. And it is a wound healing material that ultimately has become a standalone system for both male and female pattern hair loss, and we treat patients from all over the world, and we have a lot of experience. So to begin with, it is important for you to make some distinctions between the different modalities using PRP, or platelet-rich plasma. Currently, thanks to, I would like to say, our work, which began 7 or 8 years ago when we were first using this material to help people with hair transplant. We're trying to help patients heal the donor area from the strip harvesting from surgery, as well as to improve the survivability of the hair grafts. Well, a nice side effect was that thinning hair became thicker. Well, to make a long story short, I took it upon myself to look at trying to use this treatment of using PRP and extracellular matrix to help stimulate hair growth in a predictable way for men and women with hair loss. Well, since we were pioneering this treatment, and we were, of course, overcoming a lot of challenges along the way, and we were seeing very impressive results, we just kept on working, and seeing how effective it was on a very wide range of patients. And certainly it has worked out to be so effective that it has become, at this point, a standard that, that any other treatment in my mind is going to be compared to. Now currently, a lot of doctors, having finally recognized the value of PRP, and I say finally because back 7 or 8 years ago, and for years after that, a lot of my colleagues were not only skeptical, as well as openly dismissive about the use of PRP in hair loss, and now it's become quite popular. Thanks to also some publications in the dermatology literature which recognizes the value of PRP. Now I would differentiate for you that TrichoStem hair regeneration is different from PRP treatments alone. And you asked about PRP numbers of sessions. Well, I'll tell you a little bit about what we do that I think will be can be very easy to differentiate. As it was pointed out earlier, the early signs that there was something that could be derived from using PRP and extracellular matrix occurred when a patient was seen a year after transplant surgery, which meant that the effect was clearly working for over a year. And so in our approach, we have studied and essentially looked back at our patients because we were able to follow our patients very closely. We saw our patients every 3 to 6 months for the duration of multiple years, often beyond 5 years. And we have patients where a single injection treatment session lasted and had sustainable growth for over 5 years. Now, of course, with time, we learned that not everybody gets to have that longevity. And with that comes, of course, the knowledge that is derived from and ultimately develops into a classification system. What I've learned essentially is we have to look at patients individually by the variables that include the gender, the age of onset of hair loss, the rate of progression, degree of progression, and other variables such as previous surgeries, hormonal issues, and other medical related issues. From that, we not only have an algorithm for individual patients, but we also have a classification system. With that, we've developed individualized treatment plans. Now, when you ask the question for someone like yourself, a 40-year-old man, we would essentially likely, in our TrichoStem Hair Regeneration system, do a single injection treatment session. And then we would follow you. We would see you at 3 months, 6 months, 9 months, essentially every 3 to 6 months, until I would most likely predict would be a plateauing effect, somewhere around the 15 to 18 month point. And then upon reevaluation, we would consider possibly doing a second treatment. We call that the booster treatment. And it is based on the experience that we've had with other patients. We don't always do a booster, but a lot of our patients who have moderate to advanced hair loss, we do a second injection. After that, the hair loss treatment, the second treatment, we often are able to see sustainable improvement for several years. Again, it is about the individual, and that's why we developed these individualized treatment plans. Now, this is in sharp distinction to what is a current standard amongst a lot of my colleagues who are mostly new to using PRP and basically sharing the same basic strategy and formulations, whether it's PRP or PRP with A-cell. And the injection systems are essentially either a monthly treatment sessions or once every 3 to 4 months. And I can tell you that from a lot of patients who have come to us who had this treatment done elsewhere, it is certainly very challenging for anyone to get scalp injections, and not a single injection, but multiple injections done monthly. And it's, in my opinion, almost a setup for failure. I realize that this is the current state of knowledge of a lot of my colleagues, and what we have done is certainly far, I would argue, much more advanced from the level of experience we've been able to attain. We have been able to minimize that. As I said earlier, we treat patients from all over the world. It is unsustainable for someone who comes to us from the other side of the world to come back every month or every 3 months. And so we've learned with a lot of experience the longevity of the treatments, and further with all that experience, the individual predictors of the outcome that we can anticipate. And again, from that we've developed treatment plans. So I think it's important for you to meet with doctors and ask them about their experience with your type of situation. Currently, a lot of dermatologists are saying that PRP works 50% of the time. And a lot of our patients who come to us after going elsewhere will say that very often they weren't sure about what the outcome would be. And of course, that comes from not having that much experience and not really understanding this type of management. Hair loss is managed, and it has to be done with experience, in my opinion. And I think that it is very important for you to find an experienced doctor who can give you a clear understanding of this strategy and what the outcomes can be expected. In medicine, there are no guarantees, but there is certain probabilities. And I think that that's important to be able to get a sense of when you have a consultation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.